2 new cases were added to the cluster infection in China Airlines over the weekend. Case number 1183, a flight instructor for the airline, was overlooked by the Central Epidemic Command Center because he came into contact with case number 1153 just 1 hour after the contact tracing list was finalized. It was learned that before he had any symptoms, the flight instructor was giving lessons to other trainees over a period of 3 days. Experts are calling for patients' contact history to be traced back further to prevent such a mishap.
The latest addition to the China Airlines cluster infection has been identified. Case number 1183 was in close contact with case number 1153 during flight simulator training, but had slipped through the cracks since the two interacted just an hour after the authorities finalized the contact tracing list. Many doctors believe the case underscores the importance of a more in-depth outbreak investigation.
If, for example, they had close interaction, in other words, no social distancing like a handshake or face-to-face conversation while less than 2 meters apart in a closed space, these are all investigative factors to be taken into consideration.
According to China Medical University Hospital Deputy Chief Dr. Huang Gaobing, the current outbreak investigation procedures are much too rigid. Time should not be the only factor to consider. Spatial parameters should also be taken into account. He said it's better to overcompensate than miss that 1 in 1,000. Dr. Huang Liming, chief of National Taiwan University Children's Hospital, remarked that no one can be sure of exactly when their symptoms started to show up, so the investigation window should be adjusted. Instead of a 2-day period, the investigation window should be expanded to include those that came in contact half a day to a day earlier.
Because in a simulator, the space is relatively cramped. I heard of his whereabouts after. It seemed that this instructor still gave lessons, so everyone is actually quite nervous. If the authorities can conduct immediate screenings, for example, or help in some ways, that may help minimize feelings of anxiety and fear.
The former pilot pointed out that in a simulator training session, the space is shared by at least 3 people. Flight attendants may also join the classes, so a 1-hour gap could significantly increase the risk of community infection. Meanwhile, according to an unnamed source who works in Novotel, the hotel wait staff only wore disposable raincoats when delivering meals, which is inadequate as PPE. Additionally, there was not enough time to thoroughly sterilize the rooms between guests. Doctors think that this could increase the risk for staff to come into contact with the virus.
If you repeat the use of disposable raincoats, you must be sure to sterilize them thoroughly because the point of putting on PPE is to prevent active viruses from transferring onto clothing, so you would not touch the viruses by accident and get contact infection.
Now that more cases have been added to the Novotel cluster, doctors think the observation period should be extended by another 14 days. If no more new cases emerge by the 22nd, the doctors can then breathe a sigh of relief.